Welcome back. A sobering reminder this morning of the risks our frontline health workers face every day. With confirmation, Melbourne ICU nurse Gillian Dempsey has died after contracting COVID.
So sad, isn't it? We are joined now by general practitioner Dr. Mikesh Haikerwal in Melbourne. Doctor, thank you for your time this morning. It really does drive home the fact, doesn't it, that health workers are putting their lives on the line every day for the rest of us.
This has gone on since March last year. Every day in the front line, everyone is worried about their own health whilst looking after the public. We're very saddened by the death of our colleague, and every death is a death too many, and especially when it's from this terrible disease. There are things that we can do to improve it, and that's to make sure that everybody's vaccinated so there's less chance of badly infected people getting into hospitals, so you're reducing the risk burden on the people in hospital looking after you. The issue about boosters is important now, and it's not if or either, it's you must have the booster as well once you get to your 6 months or if you're immunocompromised. That will make sure you are safe, but also people who are looking after you are also less likely to get infected. The issues around protective care are important as well, and that's in hospitals and in the out-of-hospital space. So unfortunately, it's the nightmare scenario we all worry about. We're really desperately sorry for our colleague and her family that have had to face this death. And we want to make sure that we have a safer environment to make sure these things are minimised. It's never perfect, but you need to maximise people's protection and minimise exposure.
Dr. Haikerwal, you know, and obviously we're sending our condolences out to her family, friends and colleagues for Gillian Dempsey. But you mentioned protection there. And how important is it to protect our healthcare workers still at this time?
It's absolutely vital. It's been the golden sword to protect us until we got the vaccine. Now we've got the vaccine, that's another protection that we can have, and we must use it. There's a lot of misinformation, misapprehension, and we've got to make sure people get the right message. Vaccines are safe. Vaccines should be used, but make sure you understand why, and do it because you have to, for your own protection, not because you're told to by law or by mandates. You do it because you know it's the right thing to do. And we need to get the right information to people to be able to make that right decision. And I think at the moment there's so much miscommunication, and we've got to make sure people are clear about it. It's safe, it's easy, it's the best thing to do. You protect yourself and those around you by doing this, and it's a very, very minimal risk. And by the way, because of work done, including through the media, by the way, the federal government has actually got a no-fault compensation scheme, so if things are a problem, you'll be picked up, your back's taken as a patient and as a provider of those services.
I think as things settle into some kind of sense of a new normal, it's easy to forget that Victoria is still recording around 1,000 cases a day. Are we seeing a lot of breakthrough infection on the front line in hospitals?
Yeah, look, I certainly see it in hospitals. The numbers are dropping off, however, thank goodness, because of the vaccination. Where I'm standing here right now in my clinic, where we do COVID testing, yesterday, in a very small batch of people, I reported 4 positive cases. 4 positive cases, all who have been vaccinated before, and it shows that the vaccine is good, but it's not perfect. And if you do vaccinate, you reduce the disease burden, and those people are at home and doing well, but unfortunately people can get vaccinated, can get infection even if they are vaccinated.
You know, some people may want to use this tragedy to question the efficacy of vaccines out there. What do you say to them?
I think get a life. Vaccines are safe. Without the vaccines, the hospitals will be overflowing. We'd have a nightmare scenario where many people were actually in hospital and dying. And by the way, each and every one of my colleagues out there across the hospital system and in the out-of-hospital system are doing our damnedest to look after people and make sure that they are looked after and safe. But we are putting our lives at risk every single minute we're in that environment. And if you reduce the risk that we face, it means we can look after you. And actually, we can look after people who haven't got COVID, who still need to have their care. People with cancer, people with heart disease, people with kidney disease, and make sure that they're well looked after. So there's an awful lot that we need to do to make sure we keep our people safe. Both our citizens are people who are in the community, but also our healthcare workers who are doing our utmost to look after them.
Yeah, they are making enormous sacrifices for the rest of us every single day, aren't they? And they have been for such a long time. Dr. Karl, well, we appreciate your time and your insights and your passion as always as well. Thank you for joining us this morning. Stay with us. More of Today right after this as we remember Victorian nurse Gillian Dempsey.